think that government does well in healthcare. I think it's proven by the VA that the government doesn't do well in healthcare. So we need to find alternatives. What's right now is not working. What we had before Obamacare was not working. I think you increase competition. I think that's the way to do it. And I also believe in allowing states to take more control. I think that will help them effectively manage their own citizens because every state is so different. I think putting more in the hands of the states. If you have a state that needs to expand Medicaid and you need those Medicaid dollars, then that state needs to decide it for itself. But every state isn't created equal. And that's where I align on that. It's just, I think that the free marketplace does better than
Okay, so do you have a health care plan or no?
Well, luckily, I'm 24, so I am still with my parents. And to there are things, they can laugh.
Stop. She's being honest.
And to say, and that's exactly what I'm saying, to say that there are things from Obamacare that are not positive, that's not true. And most Republicans, most conservative, most Trump supporters don't believe that every single tenet of Obamacare is bad. I do believe that allowing people to stay on their parents' health insurance until they're 26, I think that is a worthwhile discussion and conversation to have. Now for me, if that were taken away from me, I'm okay. I don't need it. If it's for the betterment of a free market system and healthcare is going to be better for it, I'm okay with that. But there are tenets of Obamacare that are positive. I do believe.
Oh, great. What?
I believe staying on your parents' health insurance. I do think that there needs to be a better method for pre-existing conditions. I agree with you on that. There are some conservatives that don't. I do believe that we need to have a mechanism for those with pre-existing conditions, and I think the Senate Health Bill did have those stipulations. Now, it's not perfect. I'm not saying it's perfect. There's a lot of work to be done. But I think that one thing we can agree on is Obamacare is in a death spiral. So something.
It's in a death spiral, but it's in a death spiral being sabotaged by the President of the United States. Listen, one second. He could either, now that the bill hasn't gone through, a decent, I would argue, a decent human being would say, okay, let's do whatever we can to make the system that's in place work and thrive. It's not my bill, but instead, he's making it harder for people to sign up for Obamacare, and he's closing down those 18 assistant help places that help you sign up for Obamacare. He's doing things that are just not presidential. I want the leader of the country to want me to succeed.
I think that he does, and I think that he's also, we have to understand that.
He definitely does not want me to succeed.
I can't speak for him personally, but I can tell you that the voters spoke. I mean, elections have consequences. I think the American people are not mean-spirited. We don't want to all kill each other. Let's hope this isn't the purge. But the American people voted in 2010, in 2012, and in 2016, and they said, we don't want Obamacare. This is failing us. So we need to do something.
Okay, let's move on from healthcare. Okay, we both agree. Not nothing. I mean, we agree that